You're listening to Mental Health Unplugged, grabbing the aux. Mental Health Unplugged
is a growing community of young adult and youth leaders in Illinois with an interest in mental health. And this is the podcast, brought to you by NAMI Illinois, the National Alliance of Mental Illness Illinois State Organization. This podcast features conversations with the Mental Health
Unplugged
Work Group, with guests and spotlights on topics that matter to us. This work group focuses on creating and applying innovative strategies that involve three pillars: anti stigma, advocacy, and building a community of support, providing the voice to emphasize the youth and young adult perspective. Disclaimer: we are not psychiatrists, clinicians, and we are not social workers, but we are experts in our own experience with mental health and wellness. We call this living experience. Our expertise are developed from our experiences as individuals, as young people, and our passions. Everyone has mental health. You are not alone, and more than enough. It's time to act and talk about it. Let's do this. Hey, yay! Welcome to
Mental Health Unplugged.
From NAMI, Illinois. This is
Mental Health Unplugged, grabbing the aux.
the Youth and Young Adult Illinoisan Mental Health and Wellness Podcast. All opinions of the panelists do not reflect NAMI, Illinois. Recorded over a virtual platform, my name is Teklii D, Director for
Mental Health Unplugged.
Contemporary Media Specialist. We are joined by Mental Health
Unplugged
members, and I will let them introduce themselves.
Hi, I'm Arielle H. I'm the Stevenson Center Fellow at NAMI, Illinois, and I help run Mental Health Unplugged with Teklii.
Hello, everyone. My name is Annie Camps. I am the current Miss Mississippi Crown 2024 in the Miss America organization. My community service initiative is Surviving Adversity Through Civic Engagement. So, this is one of the platforms in which I'm able to give back and lower barriers of access through resources.
Thank you, Annie and Ariel, for being here. I always love when Annie says civic engagement because that's what we're all about. So, since many of us, well, hold on, I want to start here. Ariel brought this wonderful topic to us about healthcare because they're turning 26 and it can be intimidating to get involved with healthcare and kind of jump into what we need to know. You've probably seen many commercials on TV about healthcare.gov, and a lot of people talk about the Affordable Cares Act, also known as ACA. But what do we know about healthcare? And how many of us has already experienced trying to navigate the system? Getting the conversation started, how do we feel generally about health insurance?
I feel like I want to have health insurance. I didn't know it was a thing that people are like, yeah, I'm going to go without health insurance for however long. Like, that's like scary because I don't want something really horrible to happen. And then, like, oh my God, I have to pay a lot of money because, I mean, even with health insurance, you probably still have to pay a lot of money because the United States healthcare system is not the best. So I want health insurance, but I've been at my mom's my whole life. So anything outside of that, I just don't know a lot of information about.
I want to point out that I am currently 25. Ariel is like a soon to be 26-year-old. Annie, what's your opinion on my mentioning your age?
I am 26, so I would be the one out of the three of us who can talk about the transition. I also do have some opinions because my partner, Dan, is also 26 and they recently had to change insurance, but they have a pre existing condition and all of that good stuff. So that's a lot different than my spiel.
It's important to mention the ages because I didn't know you got kicked off your health insurance when you were 26. I had like no idea. I
You
just
didn't
kind of
know
like,
that?
I didn't
When
know
did you
that.
learn?
Like a year ago, which is fair. I
Jeez.
was younger, but like I found out a year ago that that was something that legitimately happened. I thought you would have a grace period or something
Oh.
like that. And they were like, no, what are you thinking, Teklii? That's not what's going to happen. So when do I need to start thinking about it?
I knew it would happen
Today.
because everyone would make jokes. It was one of those things where it's like 18 you can vote, 21 you can go out to drink, 24, 25 you'll get a discount on rental cars, 26 you have your own insurance. So it was one of those like common known things for me, but it wasn't until I was 24 and I started realizing, oh wait, oh no. And then I became the uninsured.
I mean, I have an older sister, so I knew that she was going to get kicked off my mom's insurance.
Yeah, it's just not something that I thought about when I was younger. And so finding that information out, I kind of got like a little more, I need to figure out what's going on. And then there was a period of time where I didn't have health insurance, but that was not my own fault at that point in time. And so I learned way more about health insurance and what I need to do there, how it affects like everyday life and how important it is to have it. Annie, what are your thoughts?
Well, I wish that we just had more of a general knowledge of health insurance as a whole. So then the large idea of turning 26 and being dropped off your parents' insurance would be a lot easier, kind of how it is like when we get our driver's license. It's like this is the class you go through, this is the test you take, everyone knows about it. It's kind of consistent to where it's some sort of like Bigfoot idea, like, oh, you turn 26 and then you can't get sick and you're out of luck. And so, again, it's just one of those things with education helps, but also I have my own health insurance and apparently very good health insurance. That's what they say. But what does that even mean? Because I still pay copays and everyone looks at it, they're like, that's good insurance. Well, then why am I paying $45 to get a freckle removed and then I get a bill more for the freckle removal? What is the insurance for? Do I know? No. Is it apparently good? I guess. So it's that kind of information to where I was going to the wrong dentist for like 3 visits before they finally figured out it wasn't covered. But it's the good insurance. Who, it's one of those long journeys that even if you know what you need, I don't even know. Is my night guard covered? You tell me.
Oh, was it? I think mine was.
Apparently, we have the good insurance. We get night guards. Ooh.
Yeah, from apparently a lot of insurances don't consider like teeth and eyes to be important health things, so they aren't covered by health insurance. Like dentists or optometrists and such.
What about healthcare? Like, because I know that there are different levels. Like, I found all this out through my experience with getting a health insurance. There's like silver, there's platinum, there's gold. They got color coordinating. There's different tiers. And then when you guys brought up dental, because it's cosmetic and it's not considered health insurance, but that is
But
a
it's so
misunderstanding.
stupid. That doesn't make any sense though, because dental, like your teeth, if you lose a tooth, infection. I mean, root canals. Apparently, I think they're going back and being like, maybe root canals aren't so good. But like the perfect meaning of root canal, because your tooth is like rotting from the inside. That's not good for you. That can hurt your whole health. So
That's why it's so important to bring up what healthcare is. And while this episode isn't about the Affordable Cares Act, ACA, it's important to bring up because it does have to do with health insurance. So, a little bit about ACA, which I did not know before we had our pillar meeting what ACA was. And we did have a guest at our pillar meeting about, health insurance, what it's about, but I did not know the acronym. So, ACA, the Affordable Cares Act, is the name for the Comprehensive Healthcare Reform Law that was passed in 2010 and its amendments. The law addresses health insurance coverage, healthcare cost, and preventative care. It's fully known as Patient Protection and Affordable Cares Act. It's the full name if you ever want to look it up yourself. But some parts of that relate to how healthcare.gov works, the marketplace, which is a term used in insurance talk or health insurance talk about where you can look up those different plans and what covers what. Dental is something that like the marketplace will look over, healthcare, different tiers, medication, etc. And then the more commonly referred to or known healthcare insurance, Medicaid. So who here has already had an experience involving healthcare or the health insurance system?
I did learn about the Affordable Care Act right when it came out, actually due to pageantry, because we would be asked the question, which do you support, the Affordable Care Act or the Obamacare Act? Shocker to anyone listening, those are the same thing.
okay, I
So,
was gonna be like, wait a second, what's the difference?
yep, and so a lot of girls would go on a tangent either for or against Mr. Barack Obama and would kind of show their colors, whereas then others would be like, that's actually the same thing. Thank you for asking. But I did have to learn about it then, and then it was actually something that my family benefited from a little bit later on.
Do you think that is a common experience for people to not know that there can be many names to refer to health insurance and or the legislative that goes along with it?
Oh, absolutely. It stemmed from, I believe it was a Jimmy Kimmel YouTube clip that was around the area of him going and asking the same thing. And so it talked a lot about the stereotypes and stigma around different healthcare systems and how we know them. the same way there was another video that kind of stemmed into food stamps and SNAP benefits. And so people were saying, food stamps are terrible, but then they were talking about supplemental nutrition advancement plans, and they thought that was incredible, and their family had actually benefited from that. So a lot of different programs go by different names because, again, a lot of people don't know the full name. Again, I don't know the PP that comes before the Affordable Cares Act, but I know the Affordable Cares Act, and I also know it's synonymous with Obamacare, but that's something that I had to learn. And so there are probably still people in the world who think that all of the four names that you said were synonymous with each other all mean four different programs in which we're putting funding into, which then further upsets them around the medical healthcare system.
That is something that Chris Garcia from CCHCC, the Champaign County Healthcare Consumers, who was our guest for the Pillar meeting, talks a little bit more about.
And they thought that was incredible, and their family had actually benefited from that. So a lot of different programs go by different names because, again, a lot of people don't know the full name. Again, I don't know the PP that comes before the Affordable Cares Act, but I know the Affordable Cares Act, and I also know it's synonymous with Obamacare, but that's something that I had to learn. And so there are probably still people in the world who think that all of the four names that you said were synonymous with each other all mean four different programs in which we're putting funding into, which then further upsets them around the medical healthcare system.
That is something that Chris Garcia from CCHCC, the Champaign County Healthcare Consumers, who was our guest for the Pillar meeting, talks a little bit more about.
All right, awesome. Thanks for having me again. So happy to be here and kind of present on some of the info that we offer to our general kind of clients. So I've been working with Champaign County Healthcare Consumers for a little over 10 years now. So essentially, when the ACA rolled out and all the new kind of insurance policies became a thing, we started off as being on the ground to get enrollments and kind of be advocates and help people navigate the process. It is one of those things that you don't get taught. So one of the key things that we like to remind folks is that people forget that the ACA has a second part. Everyone knows it by the Affordable Care Act, the ACA, Obamacare, but the actual policy itself is the Patient Protection and Affordable Care Act. So that first little part of the law is the part that is kind of more universal. So sure, expansion of Medicaid is one component. The creation of this marketplace website where you can shop around is the other big part. But the patient protection part is really what kind of gave it a lot of its kind of teeth, what the changes were going to be. So what that means is that across the board, whether it was student policy or your employer, they had to now offer essential benefits. For example, like I don't take medicine, so why do I need a prescription in my policy? I could save some money if I remove that. And then, now my policy is no longer comprehensive. It's kind of picking and choosing the things that you want. Those kind of plans, they still exist. And so it's definitely good to kind of like ask for a comprehensive plan. A lot of random companies are out there trying to sell things of that sort. And so these kind of little things really kind of hurt the policies overall. And so what the patient protection part did is it essentially said across the board, every plan has to have all of these things included, regardless of whether you need them or not. So that is kind of the first big part of it. So that includes, primary care prevention, specialist care, ambulatory services, prescription coverage, your hospitalization, your emergency services. Definitely a kind of game changer that happened was they made it so that mental health, behavioral counseling, things of that sort were no longer going to be considered specialty. Let's see. the whole issue with prior existing conditions, luckily is no longer a thing. So you don't have to disclose any information prior to getting the insurance. They actually don't even ask you anymore, which is really nice. You guys are still young and I'm not that old, but I do remember the days where they asked you everything about your medical history. And if you left one thing out, they would just pull your insurance from under you and good luck finding another policy to take you. They don't ask you for any of your medical information at all. So it's really just based on your income, where you live, and your like household size, your tax household size. And so based on those things, it's a lot more kind of streamlined process. There's no risk of, them looking into your history and finding something out. So that is definitely a big issue with just kind of getting people to sign up and not being worried about whether they're going to qualify. Those requirements are a lot more easier to work with now. So pre-existing additions, not an issue.
So during our pillar meeting earlier in the month, which is when our community meets and collectively has a conversation about our topics, we discussed questions that we had about healthcare. This included what are the top 3 things young adults should know about healthcare? A couple of questions about dental, which we kind of discussed earlier. Are there taxes involved? What if I have a pre existing condition? Does that limit health insurance options? Or the general question of how can I make sure my current providers take my new insurance? When we talk about pre existing conditions, Annie did mention something interesting that I would love for you to elaborate on your experience when it came to health insurance.
Yeah, thank you for asking. So my partner Dan actually has diabetes. He's had diabetes since he was 10. And so he just turned 26. And so that was one of the really large defining moments in our life because that meant he had to get a full-time job that had insurance benefits so that the cost of healthcare and treatment and all of that wouldn't outweigh the cost that we would have to pay for out-of-pocket insurance. And so now, as we're going through systems in life, I actually just resigned from a job of mine. I was able to do that because I am on his health care and he still has his. And so, making those life decisions, unfortunately, due to his pre existing condition, the fact that he and I together really cannot afford treatment and care for an entire year without insurance, we have no other option but to have him be full-time employed. And so that's been something that's been a really big worry because, of course, now it's in that cycle of you have to work to maintain your health, but then your working is taking a toll on your health and especially on mental health there. It's daunting knowing, okay, well, if he's going to quit his job for any reason XYZ or even just leave, I then need to pick up something immediately so that we can cover that and then going through the process of filing because I had to fill out specific paperwork because we're partners and not legally married. So that was very interesting because diabetes is not one of the conditions in which you can be, denied anything per se. However, the cost of coverage and the deductibles are still about $5,000 a year. And so that's very, very high comparatively to a lot of the other insurance programs. And so the note, however, that Teklii was referring to was myself getting on Dan's insurance and having been or not been diagnosed with borderline personality disorder. That's actually a separate conversation around insurance that I found out in college. My insurance provider would cover the cost of therapy services if I was not diagnosed with any sort of mental disability or handicap. So the moment I would be officially diagnosed for that, my insurance would cover medical treatments and medicine, but would no longer cover therapy. And since I and my therapist had decided at 23 at that time, medication wasn't the route that I wanted to go, we did not officially diagnose me with borderline personality disorder so that my insurance would cover my therapy services. And so that's still where I'm at. I legally do not have a diagnosis because my insurance still covers my therapy, and I'm not choosing to be medicated at this time. Now, if I did want to go down that journey, I would have to make the decision to no longer go to therapy or pay for that out of pocket. And then, God forbid, medication isn't the journey that I want. I will have to pay out of pocket for therapy for the rest of the time being. So it's an interesting journey. And I really do appreciate you for asking that question because it is different for everyone. And it definitely does do a hindrance for me not having an official diagnosis. However, the cost and benefit that therapy gives me far outweighs that.
I appreciate you sharing that and your experience with health insurance and therapy. And I find it really interesting because when I was on a different plan for health insurance, my therapy was completely taken care of. I do not have a diagnosis officially either. And I wonder if that would have an effect on it because I never looked into that because I was so like, I don't have to pay a copay. It would have cost like $120 and I could still have therapy. And it was talk therapy specifically. So it's really interesting that there's these little, I want to say clauses in insurance policies when you're subscribing to them. Because it sounds like our healthcare providers or the healthcare workers are finding ways around therapy or health insurance so that we as patients or clients can still be seen. I didn't realize that that was something that may or may not be common, but I find that really interesting.
Well, I also find that the journey that I'm diving deeper into is realizing that a lot of the things are kind of like domino effect. So, in order for my DMT therapy or anything above and beyond to be covered, I do have to be diagnosed. I do have to have at least attempted to take medication. And so, those are types of steps that are like, hey, at this point, although I would like that type of treatment, and through this insurance plan, I can get to that with it being covered. I personally don't want to do medication at this time. That's not the journey that I'm on. And I'm also not in the place where I can financially cover that on my own. So, yeah, there are some ways in which it can be covered, but that's going through every single step. So sometimes, again, you can do elective surgery where you choose to pay, but your insurance won't cover unless there are these 4 or 5 criterion in which you hit. And so that's always an interesting journey and a hindrance on basically all healthcare and mental health journeys. And even when it comes to dentistry, with shaming, already it's hard enough to go to the doctor. And then you go and there's all these hoops and all these things, and you have to keep going and you have to keep scheduling. And it's at some point you look and you're like, well, what is the point in having this? And so it's a larger conversation than healthcare insurance and the insurance system itself, more of making it something that is easy to use, that people understand, that are less hoops, so they can say, here's the problem. I'm going to go to the doctor. We're going to get it covered. And I have to pay $20 instead of 2000.
I agree. It does sound like there is a lot more going on when it comes to health in general. Not only when it comes to health insurance, but health care, and then navigating how those systems coexist with each other. I know I've heard from a lot of people that mental health, wellness, it can be intimidating for lack of a better term, especially when you're just starting out as an emerging adult and getting involved with things, both personally trying to find information and then generally what information is out there to find because you're basically walking through or navigating a system that you're unfamiliar with. And we know that there are some resources such as family services or nonprofits that can help with guiding through this process. Earlier in the month, we had Chris Garcia from Champaign County Healthcare Consumers, or CCHCC, speak at an event with us and gave us some tips. For example, to start looking into policies 2 months before our 26th birthday, investigate what insurances our current providers, therapists, doctors, etc., accept as healthcare insurances because not all or every agency takes the same or all insurance policies. Do you think that there are things that we can do as a community to help build better knowledge and advocacy when it comes to getting health insurance?
Unfortunately, I think that we have the marketplace. There are actual commercials about picking insurance on TV. They talk about everything that comes with it. It just comes with self-education of looking into it and understanding the policies. And so I wish I I could say having like community programs in which we get together and do it together. They have those at the library. I've read about them. I just don't go to them. No one goes to them. It's literally the same thing as like doing taxes. We just pay people to do our taxes, but we can't pay people to do our insurance. And so it's one of those very hard, tedious FAFSA like things that unfortunately we are given some of the knowledge needed to navigate it. But I'm just going to put one hand in the sky to say I've never read that knowledge. I just look at it and start to hyperventilate.
Yeah, I agree. I think it's a lot of self-teaching, essentially. Even really important terms related to insurance in general, not even just health insurance, but like deductible and premiums and all of those things. I had no idea what that stuff meant until like a couple of years ago when my sister started working for an insurance agency. And I was like, okay, what are these things? And even now I'm like kind of vague. Like, I think I know what they are. Important things to know, but hard to understand.
We need a health insurance glossary. Because, yeah, that big words that relate specifically to a topic like health insurance that no one else talks about feels a little gatekeeping because it's like, how am I supposed to find this information if I don't know what to look for? But it's not something people talk about a lot. So, is there anything we wish we knew before needing health insurance or going into trying to find out more about health insurance? Like, I wish I knew what the different plan types were and what the tiers were.
Whenever someone would say, oh, they got insurance with their job, I thought their job covered their insurance. It wasn't until 2 years ago I realized you still pay for your insurance. So I wish we could change the vocabulary around insurance.
Interestingly enough, it's common for health insurance to have people in communities to explain that information. There are people who will sit down with you and explain the policies, explain what kind of services you need. They will even walk you through how to apply for it as an independent person or individual.
Where are these secret underground people?
Well, with us, we called the insurers that we wanted to go with. They had a whole department as a part of the hospital, and we went to their offices and they walked us through the whole plan. I won't say the process wasn't long or tedious, or trying to get the information to get that person was not challenging.
I have a question that I don't think we can answer. If you were to stay with the same job or position or state in life, would healthcare be something that's kind of like a partner where you keep it forever and you don't really change? Or is it something that you want to like look into different programs and change it and update it? I know that that was a really vague question, and I wasn't at the pillar meeting earlier this month, and I know that they had asked some questions that we had Mr. Garcia answer. And so, if you could, I would love if we could play those back because I know that that conversation may help.
Your question is so valid and a reality for many individuals who are subscribing for health insurance through their workplaces. Chris Garcia from Champaign County Healthcare's Consumers, or CCHCC, spoke with us and answered some of our questions about health insurance. Turn it over to Chris from Champaign County Healthcare Consumers.
So yeah, you all kind of sent some questions my way. So I was just kind of run through kind of a full kind of how to, what you need to know. Um, Essentially, like I said, what we do is we do kind of service one-on-one client-oriented assistance, so enrollments and appeals and billing disputes and things of that sort. It's kind of like filing your taxes. If you never do it on your own, you're always going to someone. Same thing with insurance. If you always get it through your school or your employer, it's not something you ever actually have to tackle yourself. And so it's really kind of cool to see that younger folks are kind of being interested and kind of being proactive about it, because that is definitely something that we advocate for. Just a long-term healthcare awareness, involvement, and usability of the healthcare system overall. A lot of my focus revolves around mental health, behavioral health, substance use, and folks that are either already receiving treatment or looking to get treatment while incarcerated, so that when they get released, they can continue treatment. So we want to make sure that they're covered for that time frame, so that there's no lapse in their treatment plan. So Overall, though, we help anyone. So it doesn't matter, age, income. Everyone's got questions, and hopefully we're available and able to answer as much as we can. But since the focus is more on young adults and that like younger population, early to mid 20s, especially when those transitionary things are happening where you're aging out of your parents' plans or graduating from college and starting off new jobs, and sometimes people go into self-employment. And if you're kind of starting your own business, that's something that you're going to have to tackle yourself. So um, one of the questions you all posed was like, what are three key things to kind of keep in mind for young adults specifically? There was a term that we used a while back ago, kind of when the ACA was rolling out for kind of getting young people involved, and that was the young invincibles. So everyone who is fairly healthy, young, hasn't had any chronic illness or necessarily uh, been involved within the healthcare system. What's the need for paying for this insurance if you're not going to use it? You're healthy, nothing ever has happened to you. But then posing that question of like, do you have a safety net if something did happen? Not everyone has, deep pockets to be able to just kind of pay up your bills up front. And so a lot of times healthcare gets put on the back burner if it's not something that you're kind of using on a regular. And so when you're in that emergency setting, it's not the ideal time to have to deal with this stuff, right? So definitely being more proactive about it is something that we push for. The other thing is, we understand that it's not going to be affordable, even if it is an option. So there are workarounds around that. There are other kind of community programs that are available to help out if, this isn't the right time for you to have, full insurance. There are still kind of supporting programs out there. So I think just being aware of stuff like that, talking to folks that might have more information before it's an emergency situation. So one of the key parts to kind of keep this work going and supporting the efforts of affordable healthcare and quality of care and all these things is definitely, linking up with organizations like NAMI, like CCHCC that are doing the on the ground work. Whether it's just kind of following our Facebook group or, listening into the podcast when new episodes drop, things like that. Just kind of being involved, not everyone has the money to be financially supporting organizations all the time. But I think just kind of being involved in other groups and kind of speaking with your peers might give you a little bit of insight on like, maybe they're a good person to give that referral and say, hey, I know of this service that you might be able to use. One of the common things that we see here is the student population. So because the university is such a big both employer and just brings in the students, there's always kind of questions about what people are eligible for. Obviously, with the student health plans, it's comprehensive. You generally have access to the community services as well as the internal, like McKinley, that might offer here at the U of I. Between those policies and the marketplace plans, there really isn't a huge difference. Services. So when you're kind of shopping around for plans in the marketplace, specifically in the marketplace, whenever you see the copayment for your primary care, your mental health is going to be exactly the same that your primary care. So it's not going to be a specialist care. They can't charge you more or charge you less. There's parity between the two, which is one big kind of factor. So, when you're buying a plan, you know exactly what you're going to pay for that specific service. So that was definitely a big help, especially for someone like in my position, just working with folks that already have a history of mental behavior or substance. We know right off the bat, like, hey, you have these guarantees already built into the policies. So, and then, yeah, so that applied for everyone's policy across the board. So, whenever you kind of look up the 10 essential benefits, that kind of gives you that kind of picture of what all the policies include. There are differences, obviously, in the cost of those services, and that's where you shop around between the tiers. So, for example, in the marketplace, there's bronze, silver, gold, and platinum. You're not really taking medications. You're kind of risking it so that, you know, if an emergency happened, you would have some coverage, and you have, you know, probably a very high deductible, but it's probably saving you some money on the front end because you're not someone who utilizes it on a frequent level. Whereas someone who might be getting a gold level plan, it doesn't mean that they have a chronic illness and they need to have cheaper, you know, co-payments. But maybe they do. Maybe they get a lot of lab work, blood work, diagnostics, things of that sort, you know, x-rays. Those things add up. And so kind of being able to compare apples to apples, and the main difference is what your out-of-pocket cost is, makes it a lot more kind of simple to be able to make that decision. We definitely don't want people just making the decision based on the premium, because the premium might not actually reflect the whole policy and kind of the getting in the weeds for the actual details. And so that's the stuff that we help out with. You know, we'll sit down one-on-one with someone and ask, you know, what are your needs? And then compare it to all the policies that are available, which ones seem to be the ones that fit the best for you specifically. It's a case by case, everyone's got different needs. And so it's always important to kind of take the person's kind of situation into mind when you're kind of going through this process. Are included in every plan, especially on the marketplace, more than likely, definitely on employer plans and student plans. There are a few random exceptions that policies were kind of grandfathered in, but I think those have kind of been kind of diluted now, and everyone's kind of on the same page. So that's not something really. The big change, right? Turning 26, what do you do now? Now that you know that you're going to be out of your parents' policy, you know, maybe your employer doesn't offer coverage. You're taking a gap time between undergrad and grad school, whatever the situation is. There is a very specific window that you're allotted for that special enrollment. Typically, it would be 2 months prior to your actual birthday. So like if you're turning 26 in June, let's say June 15th, you could start the process as early as 2 months prior. So April, you could start shopping around, kind of comparing the policies. You could also just do it the month of your birthday, depending on what your actual policy is. So for example, sometimes the employers will say, on your birthday, you're cut off. Like the day you turn 26, you're no longer included in this policy. Others might say, we'll cover you through the end of the month. So you know you'll have coverage at least for this whole month. And so knowing those little details are definitely key things to keep in mind when you're going through this process. Because for example, if you wanted to make sure, you know, 100% not have a gap, you would want to start that process sooner. Maybe for those 2 weeks, you have double coverage, but that's okay. You know, that's not against the rules. You can do that. You just have to let the, you know, hospital, the clinic know which one's going to be your primary. Like, hey, you know, I do have current double coverage, but my other one is about to end in 10 days. So like anything that you bill to that one after this date, it's no longer going to be valid. So bill to this one. with the marketplace, they always start the policies on the first of the month. So whenever you're kind of doing that application process, like I said, you have 2 months prior, the month of your birthday, and 2 months after your birthday as well. Because the date of birth is actually the actual special circumstance that's triggering the enrollment. So when you're shopping, if you were to say, I could afford a month of a gap, I really want to kind of do my due diligence and make sure I check all the boxes before I commit to something, that's totally okay. You have that time allotted for that. If you were on, medications or you had appointments coming up and you don't want that gap, that's where being proactive really comes into play and making sure that you can get that stuff. So key dates to keep in mind when you're going through this process is, even though the application is in real time, like if you submit the application, you get an eligibility decision right there and then within minutes. It'll tell you everything you need to know about what the cost is going to be. They'll lay out the plans in front of you. It does still take them a little bit of time for processing the paperwork, especially if you need to establish, documents for citizenship or residency, income, things like that. So we like to let people know that if you're going to start the policy application and you need it to be effective on, let's say, July 1st, you would definitely want to get this stuff done before the June 15th. So the 15th of the month prior. That would give the marketplace enough time to send everything over to the insurance company that you chose. They'll add you to their system, start processing your insurance card so they can mail you that. They will send you your first invoice so you know your premium is due. That usually takes about 10 days, give or take. So if you get it in by the 15th, usually gives you plenty of time to get that paperwork, read it over, make that payment, and then you're all set.
To wrap up this episode, what is one thing, could be a story, information, or an aha moment from this conversation that we can take with us?
There is a lot of information and language around health insurance that can be scary and a lot, but it's good to do your best to figure things out and see what will work best for your situation. That's what I'm taking.
Yeah, along those lines, so even just taking advantage of those more educational programs on insurance. But if you're still a student or you have an employer who has a good healthcare or human resources department, they can talk with you through the different programs.
My aha moment was realizing that we need to talk more. Because talking with you guys about your experiences with health insurance and just the general knowledge or lack of knowledge would have helped me feel less alone when I was trying to look into it for myself. Don't forget that you too can join our mental health work group if you're between the ages of 17 and 27 years old and are interested in becoming an advocate for youth and young adults in our state. You can visit our website at namiillinois.org and find out more on our tab space. We have opportunities to speak, present, and get in on the podcast. And remember, health insurance can be scary or intimidating when we don't know what's going on. So take your time, connect with resources, and advocate for yourself and others. You can check our episode summary for more health insurance resources. Thanks for joining. Thank you for listening
To Mental Health Unplugged, Grabbing the Aux.
a NAMI Illinois podcast. Special thank you to our panelists and the National Alliance on Mental Illness Illinois State Organization for their support to emphasize youth and young adult voices. To find out more about the National Alliance on Mental Illness here in Illinois, visit namiillinois.org. That's NAMIILLINOIS.org. If you or someone you know is in a crisis, call or text the 988 Suicide and Crisis Lifeline at 988 in the United States. For imminent danger, call 911 and request a crisis intervention trained officer.